Okay, so I'm gonna introduce myself. Hello, my name's Kinsey. I'm gonna be your nurse today. We're gonna do a quick central line dressing change. I'm gonna simulate my hand sanitizing. Before I get started, can I have you verify your name and date of birth? All right, I have John Holland, date of birth 7/20/1950. Are you allergic to anything? Penicillin, okay. Anything else, any cleaning supplies, any latex or anything like that? No? All right. Well, like I said, we're gonna do a quick dressing change. Should take like 15 minutes maybe. I will have to put a mask on you and a mask on myself, and I'm gonna have you kind of reposition your body a little bit, but are you comfortable the way that the bed is now, since it will be a little bit longer of a dressing change? Yeah, you're comfortable? All right. One thing I want to add is I would move the bed up, but the bed doesn't work right now, so we're just going to leave it at this position. I'm going to go ahead and move your side rail down for me, and I'm going to get my supplies ready real quick. So I'm going to hand hygiene again before I put my mask on. So here's my patient's mask, blue side up. I'm going to put this around your face there. We're gonna move your neck as best we can to the side. So we wanna move their neck out of the way, that way their face isn't touching. And I would educate them on the purposes of the mask is just to help prevent germs and infection from getting into the site. And like I said earlier, I would want the bed waist height as well. So for this, we're gonna simulate that it is at my waist just to prevent contamination of the field as well. So I'm gonna put my mask on. And then I'm gonna hand hygiene, put some gloves on, and I'll try to talk a little louder, that way you can hear me. So I perform hand hygiene. Once again, I'm gonna simulate it for this. I'm gonna put on my clean gloves to remove the tape. And when removing the tape, I'm gonna make sure that I don't cross over as best I can and do not touch underneath, because that would be contaminating, because this part is sterile. All right, so for this, I'm gonna start over here, and I'm just gently trying to get it all kind of loose for me. And like I said, doing my best not to contaminate by touching underneath the skin underneath of it. Getting it off the lines. I'm gonna hold these back, and I'm holding on the lines, not on any part of the sterile stuff. And so when I did that, the patch didn't come off. So I will wait and use my sterile gloves and an alcohol pad to take it off. That way we're not contaminating anything. So I'm going to discard of that, and then I'm going to remove my gloves, hand hygiene yet again. And so I want to inspect my line. Check for any redness, bruising, anything, make sure that it's still in a good spot, that everything's okay with it, which it's all fine. So now I'm going to gather my supplies, and I went ahead and grabbed an alcohol pad in case we don't have one in our kits. So for this purposes, I would pretend that it is sterile as well in case I don't have one. So I'm gonna set up my supplies. we start, hand hygiene. I'd move the glasses. All right. So I'm gonna start by opening my kit, and I'm gonna kind of move these a little over. So when I open, we're gonna make sure to open away, and we don't want to have the paper go back to where, back over our sterile. So I'm gonna get it all the way open, and our outer edges are gonna be considered contaminated, so keep that in mind whenever I'm crossing my field. So I'm just gonna open it. And make sure that it doesn't fall back over. And one thing I forgot to verbalize is that I would have cleaned the table, made sure it was clean and wet. With the purple wipes, follow all the guidelines on those. So since we already are masked up, I can go ahead and remove the mask. So I'm gonna set this over to the side, and then I can go ahead and move my sterile gloves. And so when I remove my sterile gloves, I'm going to just touch them on the corner without touching anything else. And I'm gonna set them here. I'm going to set my biohazard bag up. Do you mind if I set this on your side here? All right. And I would have wanted to put the tape in there as well. So I would just note that and make sure that I switched out that trash can or put it in a different bag if needed to. So now I'm going to, like I said, we're gonna pretend that this is sterile. So this would already have been in my kit. So I'm just gonna set it in there really quick because there's not one in there. But realistically, I would not have wanted to do that. I would have wanted to already have sterile gauze in there, sterile alcohol in there. So for my biohazard patch, I'm just going to peel it and peel down. And you don't want to open this like over your kit, so I'm just gonna plop it in there, discard of this. So then for my gauze, the easiest way that I'm comfortable with is I'm just gonna open it away from my sterile and use, since this is a sterile gauze, just use the packaging it's already in. So I'm gonna pick it up for the first part, that way I don't get close to it. And same thing applies, my outer edges aren't gonna be sterile, and I don't want my paper to go back over it. All right. So there is my gauze, my bio patch. Like I said, I had to put the alcohol pad in there. Wouldn't have wanted to do that in a real scenario, but for demonstration purposes, that's what we're gonna do. So now I can hand hygiene again, get my sterile gloves on, and then we're gonna set up our supplies. So with my sterile gloves, we're gonna open, cup end down, open away from you. Consider our margins, making sure the table's at waist height, not letting the paper fall back over. Just making sure to watch everything carefully. So I'm gonna start by walking my hands, and I like to pick it up, watching the edges of my fingertips, and you can always lift your hand up more if you need to, and just adjusting once you're done. So I got my first one on, so for this one, put it underneath the cuff, lift up, keeping your body away, your sides of your arms away, just everything. And we got that one on as well. So now my hands are sterile. I'm gonna get rid of my sterile packaging. We're gonna slide that off. All right. So now I'm going to be grabbing my actual sterile fill that I'm going to be making for myself. So with this, I want to make sure that I put the shiny side down, and I'm going to kind of like cover it with my hands when I'm placing it down just to keep everything sterile, and then I'm going to set my supplies on there. So with this, pick it up by the corner, open it up. I can already tell which side is my shiny side, so I'm going to go ahead and flip it that way. Just being careful. Alright, so I'm going to flip it. And when I'm doing this, I'm keeping my body away, keeping it above my waist. So I'm going to curl my hands. And that way, I'm keeping my wrist away too. And we're going to gently set it down on our clean table and flipping those sides. And so when I did that, I made sure that on the edges that were up, I have my fingers there. That way my dirty edges aren't touching anything. So now I'm going to consider the area that's off the table is going to be contaminated, so I'm going to be aware of that. And I like to put everything in the middle, that way we're just keeping it away from the edges and keeping it my most sterile places. So now I'm going to grab the supplies I need without touching the edges. We need our alcohol, my second alcohol, which I had to place in there, and then our bio patch, and we need our tape. And like I said, with all this, just watching the sides of everything, making sure I'm not contaminating. So now I'm gonna have to open up my alcohol pad. Like I said, we're gonna pretend it's a sterile one to remove my bio patch. So I'm gonna go ahead and do that now. And so I'm going to discard of this. So when I'm doing this, I'm just going to gently use the pad to take it off. I could grab gauze if I needed to, if I felt I was gonna pull the line out. So now throw this in my biohazard. So for the next step, I'm gonna grab my gauze and then I'm going to clean. So I wanna break my cleaner, break the sides, let all the fluid drip down, and I'm gonna grab my pad. So this is, the purpose of this is to keep my left hand clean, so, and sterile. So I'm gonna grab the line, and I'm actually gonna hold down on the flange. And this, the purpose of that is just to keep my line from moving while I clean, because you wanna clean vigorously. So we're gonna start by cleaning over the site, and back and forth. Then we're gonna start away. And like I said, back and forth. We want to make a big box, keep everything clean. And then we want to go in the area under the flange. All right. And so I'm going to dispose of this, remove my gauze. And one thing with that is I probably would want to keep my left hand a little higher, that way I just double check that I'm not touching those tubes, but I didn't, so just another tip that I would probably like to consider as well. So now I'm going to place my bio patch on there. We're just going to place it down with the sides in between, trying our best. I can hold down on this if I need to not move our line. And then for our tape, and so we're just going to place this. I'm going to kind of move this down a little bit, that way it's not where the patient's neck moves, but I'm just going to place that over my line. And so once we have that, we're not really concerned about our sterile field anymore because it is dressed, so I can go ahead and remove I'm going to remove my patient's mask, remove my sterile gloves, discard of them, and perform hand hygiene. So I discarded these. Can go ahead and take your mask off right now. All I have to do is date and time everything. And so, like I said earlier, whenever we're dealing with masks, we want to make sure that we do hand hygiene because you're touching your face and everything. I would dispose of these, but we're going to keep them. So, hand hygiene. And so now I can take this part off of my dressing. So I'm going to remove the edges, pressing down, making sure that it's on there securely. And then keep this part. I'm going to use this to my pen to initial, date, and time. And then place this on the side of my dressing. And then I would reposition my patient, make sure that they're comfortable, and make sure that I document. And then I would obviously clean up all my supplies. And that's all.